got a comprehensive programme of involvement work really aimed to get the Trust right at the heart of the local community. The programme really started some 2.5 years ago, and since then we've steadily increased the public membership of the Trust, and we have increased the range and diversity of involvement opportunities for that growing number of public members.
Yeah, I mean, the good thing about the Lister is that it does all sorts of different things. It's not just committees, there's workshops, there's procurement issues and what have you, and patients are always involved in all of that, which I think is really good, because again, sometimes the people running these things don't think about just being a patient. They're working in the place, and it's very different. And equally, most of the patients don't work in the NHS. They work in businesses and all sorts of things, so they come up with all sorts of different ideas. So it's not just committees, it's every part of the hospital is being, helped by patients, and they're asking patients to come. And I think that's the best way of doing things.
So the Trust has got a systemic approach to involvement, so a whole range of staff across all different functions and tiers actively encourage involvement of public and patients, and that works very, very well for us, and it means that we get access to a whole range of different insights and perspectives that perhaps otherwise we wouldn't get. So our organisational structure is geared and set up to systematically include patient engagement through the way we work and our governance arrangements. Right at board level, we have patient stories every month. We also have a separate patient experience committee, which is dedicated to experience of patients and public when they visit our hospitals and receive our services. We also have an involvement committee which allows for wider partners and stakeholders to come together, hear what's going on in the Trust. We run a range of workshops on a very regular basis that get patients and public involved in the really important issues for them, such as catering and food, nursing staff levels, end-of-life care, elderly care services, the things that tend to really matter to patients and public.
It's a two-way thing, which encourages effective communication between young people and NHS staff. So it's to encourage staff to talk to young people, and it's to encourage young people to be able to speak up and ask questions.
It is really about fronting up and showing your personal passion and belief in the health service, and, if you like, giving people the opportunity to meet you halfway and show how passionate and inspirational they can be in coming and supporting what you're doing. The critical success factor with the work here at the Trust is you need to get the buy-in and support from your leadership of the organisation. That's really important. So your operational colleagues and your executive directors, it's really important to get their buy-in and support for engagement work that sticks. That's critically important, and I think has made the difference and has led to the work being successful here at the Trust.
Having somebody there that's got the time to actually spend with you to do that just helps. I think if you ask any volunteer why they do it, they just want to help. So once the volunteer is in that department, they become almost like one of their team.
Recruitment and engagement of public is really done on a face-to-face basis.
What we have done, we have managed to work with BME umbrella organizations, and that means working with groups which are representing ethnic minority communities in different districts. Again, looking at census data, for example, from 2011, I know, for example, that in Welland Hatfield, one of the biggest minority communities is the Polish community. So you have data and figures which kind of, if you like, demonstrating that there is a need probably to work with that community, because there are a lot of people from the Polish community living in that particular area. Then obviously the key thing and the key component of our kind of partnership is to establish some kind of relationship with the Polish community or any other community, and then try to identify community champions in those communities, so then they can be a catalyst for us to deliver those kind of different projects. So working with community champions, trying to bring different agencies together, and also with those communities and also with other agencies like Trust, like local council, like any other community and voluntary organizations, trying to identify needs within that community and then trying to respond to them.
One of the particular areas of work that we've developed is recruiting and involving young people. Certainly when we started this programme some 2.5 years ago, there were virtually no young people involved with us, and we decided it was important to get that insight into the organisation. So we have recruited some 1,000 14 to 18-year-olds over the last 2 years and have an active programme of involvement that sees them do a whole range of things with and for us. And the insight and honesty that they bring is really, really valuable to us and makes a real difference to the Trust.
Well, David came with a colleague to my school and did a workshop on patient experience. And I felt really strongly about the fact that actually as a young person you don't really get communicated to. It's more the person you're with. And so David then emailed my head of year and said, can she design a poster for what she feels? And I did, and then he emailed back and was like, okay, we have to take this further. Then we made a short film of it and everything like that.
There's always room for improvement with involvement work. I think all that we can do is to try and access those bits of the community that still feel that they've been neglected or don't get the opportunity to have their say, and we're forever on the lookout for if you like, the demographics of the area that are not necessarily represented, and getting in touch with those people and making sure that we give them the opportunity to get involved with us and have their say, and let us know how we can tailor their health services appropriately for them. I think that's really important, and it's something that we continually strive to do. One particularly successful campaign programme of work that we've developed at the Trust is our approach to youth engagement, branded the Futures membership. What we're particularly proud of with the Futures membership is that the design and brand was actually developed by our young members. We ran an intergenerational project, so we got some young members to teach some of our older members some new communications ICT skills for the first time in their life. And another, if you like, unintended consequence was that the impact on younger people who had a very different perspective on the older generation, who were seen less as remote and uncaring and more as people that you can have fun with and do stuff with in the way that they can their younger peers.
And the one thing that's been really, really useful in making it go nationwide is social media, so Twitter and Facebook and everything like that, because it's very easy to get very far coverage with media. So once we got the film in place, it made it a lot easier as well, because you could just link the film and then people would kind of retweet. And within the first, I think it was the first 12 hours of launching, we'd had 60,000 tweets and retweets.
Very often it's down to individuals. So if you have something who's enthusiastic, keen to make a difference, this is what I would say. Having individuals who are keen to make a difference, and making a tangible impact on the local community,
So our ultimate aim was to address social isolation. How we got there can change as you go along, depending on what your members want. The key message would be just remember what it is you're trying to achieve and don't worry so much about how you get there.
I think as far as involving volunteers is concerned, one of the things that I would always advocate is you start small and drip feed it in. If you try and start with a huge project, it might go well initially, but it's very hard to sustain that.
I think it's really absolutely critical to have people with can-do approach, people who are trying to and always are willing to explore different kind of opportunities for partnership working, people who are very keen to as well to address difficult issues as well, and rather than pretending that the issue doesn't exist, they're always happy to kind of to find a solution to that particular problem.
Make it fun, make it valuable, make it realistic, and always say thank you.